Picking up a little bit on a conversation we had earlier this morning talking about Hollywood pregnancies. One of the more prominent ones of late involves 46-year-old Halle Berry, who's looked natural and glowing and really full-rounded as she endeavors into her first pregnancy. Of course, this prompted the question, is it common for women in their 40s to be able to get pregnant naturally? And if so, what are some of the risks that are associated with that condition? And of course, we're very fortunate to have Dr. David Cumming join us right now, reproductive endocrinology and infertility specialist, to talk about this and break down the science into layman's terms for us, I guess. So obviously, you know, Halle Berry, she looks resplendent in her pregnancy right now. Of course, a lot of people debating whether or not it was natural or if it was something that might have required a little assistance. I guess the question to you first off is, how likely is it for a woman of 46 to get pregnant without the assistance of a doctor?
The evidence actually comes from, oddly enough, Hutterite colonies that don't have contraception and just keep having babies. On a percentage basis, it's probably about a 1% chance that anybody will become pregnant after the age of 46.
Oh, wow. So is that the age bracket where things do kind of escalate, the odds drastically are reduced, or where does this happen in terms of the aging process?
It begins probably about 13 years before menopause, so roughly around about the age of 38, the fertility rate starts going down very, very rapidly. In the early 40s, it's possible, but as you get past 45, it is very unlikely that anybody will have a spontaneous pregnancy.
Now, we're talking about this particular age bracket and some of the resources that are available to them in order to get pregnant, to have that fertilization happen. What are some of the options for women looking for that late stage or late life pregnancy? The
options actually are quite limited. The only real option is actually to use somebody else's egg. Other forms of treatment just don't work. You can't reverse time. And the in vitro fertilization without a donor egg doesn't work. Most of the other forms of treatment just don't work. So most patients who get pregnant in this age bracket, one would suspect, have been treated with someone else's egg, fertilized with a partner's sperm, and then replaced in the patient's uterus for them to carry the pregnancy.
Well, you mentioned essentially that in this case, our bodies are our own worst enemy. What are some of the risks, I guess, associated with getting pregnant at this stage in life? And is there any variance between natural attempts versus something that's assisted?
Oh, if you get the egg from a 24-year-old, the pregnancy goes the way 24-year-old pregnancies do, except that there's maybe a slight increase in miscarriage rates. If you do get pregnant with your own egg, and even if you get pregnant with somebody else's egg, you've got risks of high blood pressure problems, which can be lethal. You've got risks of diabetes, which is much more common. It's been estimated in Britain that even though the rates are low, your chance of dying in childbirth over the age of 45 are about 5 times higher than at the age of 24. Miscarriage rates are incredibly high, particularly towards the end of the 40s. There can be 90% miscarriage rates with natural eggs. It's also a problem because of chromosomal abnormalities, conditions like Down syndrome. The risk at the age of 40 is about 1 in 40, which is high, but by the time you get up to 50, it's about 1 in 8 patients will have a baby that has something like Down syndrome.
All right, well, two very quick questions before we go. Unfortunately, running out of time here this morning. In your practice, in your time as an infertility specialist, are you seeing a greater increase in the number of women in that age bracket coming to you looking for assistance to get pregnant?
Certainly the 40-plus-year-olds. The 46-plus-year-olds, we don't see that many. But one sees them, and they have to accept that the only real form of treatment is that they will need somebody else's egg.
All right, and just I guess if you can sum up in one sentence, if you are in that age bracket and you're looking to get pregnant, what's the best advice you can give to a mother?
Be realistic. Your ovaries are 46 plus. You may be great, you may look healthy, you may feel healthy, you may be healthy, you may be very attractive as Halle Berry is, but your ovaries are your ovaries.
There you go. Well, fascinating discussion here this morning, talking about midlife pregnancies with Dr. David Cumming. Appreciate you coming on the show and breaking that down into terms we can understand. Of course, plenty more breakfast television coming up after the break. Stay tuned with us here on this Friday morning.